Hello there. I am going to be explaining some of the ins and outs of the insurance process with you guys today. So sometimes people are reaching out to work with me and they're not sure if I accept their insurance. So on my website, I do list the insurances that I accept, but I wanted to explain the process in case you want to work with me and you see that I'm maybe not in network. So the first thing is that there are thousands of different insurance plans out there. The first thing that I guess is important to understand is that your therapist would have to apply to be on a certain insurance network in order to accept that plan. And so there's lots of different reasons why therapists decide to accept insurance or to not. Some therapists obviously don't accept insurance at all, but they maybe will provide you what's called a super bill or a statement of all the charges that they've charged you, and you can submit it to your insurance for reimbursement. So the first thing is just sort of understanding that there's hundreds of insurance plans, maybe thousands out there. A therapist has to apply to be on that network, right? And there is a vetting process in order for the insurance company to say, yep, this person's a therapist, they are who they say they are, they have an active license, things like that. And so you can see on my website the insurance companies that I accept and that I'm in network with. There's some that I'm pending and hopefully will be in network with them soon. It is like a 3 to 6 month process sometimes to get accepted on an insurance panel. So it's pretty intensive and it's a lot of work on the therapist's part, and just not every therapist has the time to commit to that. So that is part of why some therapists don't accept insurance. But so if you see that I don't accept your insurance, the first thing that you might want to do is call your insurance company and say, can I work with an out-of-network provider? So some insurance companies have what's called in-network providers, right? And those are therapists that are already contracted with their insurance company. And so that means you can see them and you don't have to worry about anything, right? They're already in network. An out-of-network therapist is someone who's not in that network, but sometimes insurance companies provide you with a benefit package for your out-of-network benefits. And so what that sometimes looks like is that maybe you have a deductible that you have to meet, so an out-of-pocket cost before the insurance company will cover any of the fees associated with seeing that out-of-network therapist. So let's say you wanted to see me and you had Blue Cross Blue Shield insurance. I'm not in network with them, but maybe you have out-of-network benefits, and you can call your insurance and say, hey, do I have out-of-network, and what is maybe the deductible, or what do I need to do to be able to see a therapist that's out of my network? And they should be able to walk you through that whole process. So because of COVID, some insurance companies have been waiving deductibles. So just because maybe I'm not in network with a certain insurance plan doesn't mean that we can't work together. You might have to pay a fee, or you may have a deductible you have to pay, or you may have a higher copay associated with your out of network. So the questions that you want to ask are, is Sarah Lewis, you can give my address, my credentials, which is LCSW or licensed clinical social worker, and ask them if you can work with me, and if so, if you have a deductible to meet. And then, you could ask them, once I meet that deductible, do I have a copay or a co-insurance that I need to pay? And so they'll be able to explain all this to you. And I know it's a hassle when you're trying to find a provider to add like another thing to your list of things to do, but calling the insurance company and asking these questions, that's what they're there for. They're there to answer these questions and walk you through the process. So I just encourage you to call your member services line on the back of your card and really just be that advocate for yourself to find out what your benefits are and what you're, entitled to. Because remember, with your insurance, you're paying for that service, or you're paying for that benefit. So, you pay into it. So you want to make sure you're getting the best care possible and that you're taking advantage of the services that you have. So, so that's kind of the in-network, out-of-network. Some insurance companies will allow you to see an out-of-network provider at the in-network level of sort of cost, but that is a little bit trickier. And usually it's if you're requiring like a specialist, or maybe in your area you don't have a ton of therapists that are specialized in a certain treatment area, and it's something that you want to see, hey, will my insurance company make an exception for me to see this out-of-network therapist within my in-network benefit? And so that's definitely a question you can ask. It's not something that I've seen a lot, but I'm newer to doing private practice, so maybe there are those options and I just don't have experience with it. The other thing, so the next really important thing to ask the insurance company is if you have a deductible. So this is what you are expected to pay out of your own pocket before the insurance will pay any of the treatment, right? And so asking, do I have a deductible? Now, the biggest thing here is you may have a deductible, but for mental health coverage, sometimes the deductible is waived, and that has nothing to do with COVID. Some insurance plans are starting to see, or I guess this is my thought, is that they're starting to see the importance of mental health coverage. And so, I think that's why maybe they're allowing the deductible not to apply to mental health services. I could be wrong, but ultimately it is possible that, let's say you have $1,000 deductible, ask them, does it apply to mental health? Because it could be that, yeah, you have $1,000 deductible if you want to go see a chiropractor or a physical therapist, but if you want to see a mental health therapist, it might not apply, which means that you don't have to pay $1,000 out of your own pocket before the insurance will pay for your services. So I have quite a few patients that do not have a deductible applied to their mental health benefit. So that's amazing, because then they don't have to sort of carry the burden of that large sort of out-of-pocket expense in the very beginning of service or of services. So asking about your deductible, and then your copay is usually the fee that you pay every time we see each other. So that's a fee that the insurance company asks that you pay to cover your portion of the care. The other thing is co-insurance, right? So not everybody has like a flat sort of fee flat fee copay, right? Where it's like $10, $15, $20. Some people have what's called co-insurance. And so it's like a percentage of what I charge. The insurance company requires that you pay maybe 20% of my fee or 30%. So that's another thing you want to ask when you call the insurance company is, what's my copay or co-insurance amount? And they'll be able to tell you all of this information. So the last thing I guess I would say is, if you really want to work with a certain therapist and they're not in your network, and you don't have out-of-network benefits, or maybe your deductible for out-of-network is super high and it's just not feasible for you to be able to afford that, what you can do is ask the therapist, is there any way I could do a sliding scale based on my income, or do you lower your fee at all? Like, what are the other options that I could do? The other thing you could ask is if they do what's called a super bill. So some insurance or some therapists that don't take insurance, what they do is they provide you a bill of every time that you've worked with them and a different code. There's like a code that we use for each session. And so they can provide all of this to you that then you give to your insurance company, and they write you a check and reimburse you. So I know that's a lot of information, and it's really overwhelming, again, to try to find a therapist. And right now, trying to find a therapist that is in your network, that takes your insurance and is in your network and has openings, is accepting new patients, and at a time that is, fitting into your schedule. So I know it's very overwhelming, But I think that I really wanted to create a video to kind of explain some of the insurance process. I obviously am very passionate about mental health and really just, I'm a social worker. And so it's really, I really want to help as many people as I can, even if I can't be your therapist. I want to put you in the right direction to find a therapist who can help you. So I've been offering when I can and I have the time, I do try to help and call your insurance for you and ask some of these questions. But sometimes my schedule just doesn't allow for it. And so I wanted to create a video to sort of give you some of the information so that you can know what questions to ask and sort of how to advocate for yourself. But as always, if you have questions, I'm always available to help navigate the process. I mean, I'm going to be honest, in my personal opinion, I think that mental health coverage should be free. I think that is just a fundamental human right that we should have, but that's just not the way things are in the country that we live in. And we do have insurance we have a system where insurance kind of dictates, who we can see and sort of things like that. But I try to help in the ways that I can for people to navigate these systems. So please, reach out if you have any questions and I can try to walk you through the process. Okay? Thanks.